you for joining to listen to the Fundamentals of Infusion Therapy, otherwise known as FIT, education demo. So first of all, I'd like to discuss a little bit about the Fundamentals of Infusion Therapy program. It is a virtual program, so it can be accessed anytime, anywhere, and you have the flexibility of how you will institute use of the modules. It's interactive, and I'm going to demonstrate and show you in the modules some of the motion graphics, the best practice videos, real-life patient scenarios, and teachable moment videos. These help the learner be engaged and retain the information. We also have included multiple patient care, real-life scenario critical thinking exercises, as well as we've incorporated multiple patient care settings and patient populations. There's flexibility in the way you implement the program, and it is based upon the infusion therapy standards of practice, which will provide consistent education. So first, I'd like to show you the introduction video.
Welcome to the Infusion Nurses Society Fundamentals of Infusion Therapy program, or FIT program. This program will provide evidence-based clinical information that you will be able to implement immediately in your professional practice. The INS FIT program is based on INS's infusion therapy standards of practice and consists of 8 modules. The modules are designed to be completed sequentially, beginning with Module 1, Safely Practice Infusion Therapy, and concluding with Module 8, Take the Challenge. Click the bar menu in the upper right-hand corner to access a new module, and use the next and back buttons at the bottom of the page to help navigate from page to page. Each module has a brief introduction and several components arranged in left to right fashion that cascade down the page. We encourage you to take your time as you study each module, and be sure to click on the red text that will take you to related content. Your progress toward completion is tracked within the FIT program. It will be beneficial to retake the quizzes until you achieve a score of 100%. Mastering each quiz is necessary to ensure that you understand the content, and it will help you complete the final challenge in Module 8. You will receive a certificate after you complete the entire program and post-evaluation. We wish you success in getting fit for infusion therapy practice.
Okay, so first I'd like to go into the introduction module a bit more and show you the various modules that were demonstrated on the introduction video. So we're going to talk about safely practicing infusion therapy. Then we're going to talk about the next module, which is selecting the correct vascular access device and site. The third module is insertion of the short peripheral catheter. Then we're going to learn more about caring and managing our devices, followed by administering fluids and medications, then removing devices correctly, and then finally managing complications. Our final module, Module 8, is taking the challenge, and that incorporates all of the learning that occurred in the prior 7 modules. So the first module is safely practicing infusion therapy. And this module covers infection prevention. So we have several activities in each module with different modalities for providing the education. So this first module, as I mentioned, covers infection prevention. And we talk about how infections spread and how you make an impact. This is one of the first areas where I'd like to show you where we've incorporated various practice considerations. And in these different practice areas, we cover ambulatory infusion centers, skilled nursing facilities, and provider offices. And we talk about the negative and positive actions that we can take to prevent infection. Our first best practice video is a hand hygiene video, followed by our sharps safety exercises, how to properly use personal protective equipment, disinfecting DME, and then after the learner has completed all these activities, we have our first teachable moment video. And I'm going to expand this so you can see how this activity works. So there's a brief scenario about Leah, who is our nurse, who is going to require some coaching. And as we watch this video, as Leah's preparing to place a short peripheral catheter for Ellen, our 83-year-old woman in the video, we need to coach Leah. And we're instructed to stop the video when we believe that Leah needs some coaching. So in some instances, I'm going to stop the video, and others I'm not, so you can see how this activity works.
Okay, I'm just going to wash my hands here and then we can get going. Okay.
So it says I missed the moment because I did not stop the video. So before continuing, it asks me, what should I have coached Leah about? So what I'm going to do is I'm going to select the incorrect answer so you can see what happens when I select the incorrect answer. So before continuing, it lets me know that I didn't quite get it. I missed the mark, and here's what I missed. Leah should not have cut her hand washing time short, because in the prior activities, we learned that we should wash our hands for 20 to 30 seconds. And then she didn't use paper towel to turn off the faucet, and did not remove her jewelry.
Everything's looking really good right here. Are you feeling okay?
I feel fine. Just a bit nervous.
I'm going to stop Leah and coach Leah. And it asks me, well, what am I trying to coach Leah about? So in case I just selected the stop at this moment and really didn't understand the rationale, the exercise asks me whether or not I understand why I stopped the video. So because in the prior activities, we learned that we should cleanse back and forth for at least 30 seconds, I'm going to select that answer. And it validates my thinking and my rationale.
I just want to get to feeling better so I can go home soon.
I bet. Well, we're going to take good.
I want to stop Leah again because she cleansed the site. But what am I seeing that she needs some coaching about is that she's palpating the site after she's cleansed it. And so I'm going to select that answer and see if it validates my rationale. And that's correct.
Just readjust here. Oh my goodness, my phone is buzzing. Let me turn that off really fast.
Okay, I'm going to intervene again. Leah should not have answered her phone or touched her phone during the process of a peripheral insertion of a catheter. So I'm going to select that answer. And I'm really not sure if I have everything complete, and that's correct. I actually should have selected more than one answer. Not only should she not have answered her phone, but she should dispose of her old gloves, perform hand hygiene, and put on new gloves. So at the end of this activity, it shows me that I only completed 2 correct answers out of 4, and it gives me some information about what I should review, and I can watch the video again. As the introduction video explained, it's best for the learner to go back and complete the exercise again to obtain a perfect score so that they can achieve a better score on their final challenge. But we'll go ahead and continue. The next module is selecting the right vascular access device and site. And in this activity, and these various activities, we have a motion graphic activity that involves the vascular anatomy. This is an example of one of our motion graphics. And when I select various vascular access areas, I can see what veins are available and what advantages and disadvantages are for each of them. After we review our vascular anatomy, we can discuss how to make a thorough assessment and look at various devices and resources, site selection resources. And so I'm going to select this particular PDF. And when I click on this red link PDF, it allows me to access a resource about vascular access device selection. These various PDFs are important for the learners because it gives them some background about the activities that they're going to participate in. And also in these various PDFs, these PDF documents. We have considerations for home care as well as patient populations. In this particular PDF, you can see in the second paragraph, we talk about a patient being discharged to an alternative site to home. And so we talk about the patient that's going home. And in the third paragraph, it gives more specifics about what we should consider. So these PDF documents are important for our learners because it gives them a good amount of information about each of these activities. And it's information that's based upon the standards of practice as well as the INS policies and procedures. So next we compare the various sites. We can assess our patient and determine the optimal site. We consider the devices and we practice assessing. When we get to the conclusion of this particular module, we have an activity where we apply everything that we've learned. And I'm going to show a little bit more detail on this activity. As I mentioned, we have real life patient scenarios, and this is the scenario with Richard. So the learner reads the scenario, it gives a little bit more depth about Richard's particular ongoing case, an unfolding case. In this particular scenario, Richard is in need of IV antibiotics for 6 weeks, and then the plan is for him to go home on day 3. So the learner is to begin the activity and look at the various sources they have to select an option for the best vascular access site and device for Richard. So they can ask a peer, and there's some information about what they would ask a peer. And then they can ask the patient and gain more information about the patient's considerations before they go back to making a decision about Richard's care. Once they complete that activity, we have the learner practice documentation. And when they practice documentation, I'll go ahead and just fill something in so you can see what happens when the learner fills something in. They practice their documentation and then they display what would be optimal documentation for this particular scenario. The next module I'd like to show you is the proper insertion of a short peripheral catheter. There is understanding the consequences as well as following every step. And in this activity, the learner reads about different consequences that can occur. And in this particular scenario, we're talking about infiltration and what can happen if the learner doesn't assess and care for the patient properly with insertion of a short peripheral catheter. So it describes the patient situation, what the clinician has done, and what the consequences are of those actions. Then the learner learns more about how to gather supplies, ban the bacteria. There's an activity where they match the particular steps to the process. They learn about age consideration. They look at the process at a glance and the do's and don'ts about peripheral insertion. The first best practice video I'd like to show you is the short peripheral catheter insertion. I'm going to skip ahead on the video a little bit through the introduction and show you the actual insertion.
Before every procedure, gather supplies and have everything with you. Allow time to dry completely. Now, prepare the equipment by flushing the add-on devices. Reapply the tourniquet above the intended venipuncture site. Stabilize the selected vein. Perform the venipuncture and advance the catheter. Once you observe blood in the catheter, release the tourniquet. Next, activate the safety mechanisms and connect the extension set.
And so you can see this video will continue through to conclusion of the short peripheral catheter insertion. So as in the prior module, we conclude this module with application of what we've learned about short peripheral catheter procedures. And so in this particular activity, we have Olivia, a 45-year-old patient. And so there are 4 application questions to this scenario for the learner. The 4th module is caring and managing devices. So this is care and maintenance of all vascular access devices, short peripheral catheters, midlines, and as well as central vascular access devices. So we compare the consequences when we look at caring and managing various devices. And as you may notice, there's also a PDF red link here for more resource information to help us participate in these various activities in this module. So we learn more about dressing procedures. This module covers needleless connectors as well as administration sets. We talk about the various procedures with administration set changes and dressings, as well as connectors. And this is one of the animation videos that I'd like to show you about flushing.
First, disinfect the needleless connector. Attach a 10 milliliter syringe with preservative-free 0.9% sodium chloride USP to the needleless connector while maintaining the sterility of the syringe tip. Slowly inject preservative-free 0.9% sodium chloride USP into the device, noting any resistance or sluggishness of flow. Slowly aspirate until brisk blood return is obtained. A pulsatile flushing technique of 10 short boluses of 1 milliliter, interrupted by brief pauses, may be effective at removing solid deposits. Then, remove the syringe and discard. Initiate infusion therapy as prescribed.
Then we have activities that check our understanding of that process. And then, as I showed earlier with the best practice video with the short peripheral catheter insertion, we also have the dressing change procedure for both short peripheral and CVAD midline dressing changes. We talk about the proper care and the impact of that care. And then we have another teachable moment video, as I showed you in the first module with Leah. So in this particular activity, we're coaching Leah with the dressing change procedure, similar to the one I showed you earlier. And then we apply what we learned with Harold. Again, this is another application scenario with Harold, and we learn a bit more about Harold's condition. And then we begin the activity just like we did in the prior module with our resources and considerations for Harold. And then we practice with documentation. The 5th module is administering fluids and medications. So in this module, we learn about the consequences of particular situations when we are not monitoring and administering medications properly. We learn calculations or review calculations with MedMath. We calculate a best rate for a patient named Jerry and document his care. And then we have best practice videos for continuous infusion, IV push medications, as well as intermittent infusions. Again, I just want to make note, you'll see these red links for the PDF documents that give the learner more information about these particular procedures. And then we review our understanding of the infusion methods and we apply what we've learned with Gregory. In this particular scenario with Gregory, he's going home. So we have a red link PDF resource for the patient that's going home with infusion therapy. The 6th module is removing devices the correct way. We start off with a PDF resource to learn a little bit more about the removal process. And then we have our best practice videos, short peripheral catheter removal and CVAD and midline removal. And in the CVAD removal, we are particularly focusing on the non-tunnel catheter or the PICC line removal. We evaluate the removal procedures and we talk with a colleague about removal. And then we apply what we've learned with Carlos. And this is a situation or a scenario with Carlos. And we read the scenario, the real life scenario, and then we determine how we should intervene. And then we can practice our documentation again. The last content module is managing complications and assessing complications. We have a resource here as well, and we go into detail with the varied complications that we have listed within our policies and procedure manual, as well as in the standards of practice. So we learn about how we can change the patient's outcome and recognize complications. In this particular activity, we use audio to help the learner hear an assessment that's being conducted by Aaron, the clinician, as he assesses Louise. So I'm going to play this audio so you can hear how this scenario or this particular activity works.
Hi, Louise. I'm Aaron, and I'll be assessing your IV today. How are you doing?
I'm okay. I don't love needles, but I guess you gotta do what you gotta do, right?
That's the secret to life. So, are you feeling any discomfort at or around the insertion site?
Well, there is a tingling sensation I get when I scratch it. That area feels numb.
What about burning?
No, not really, but it feels like goosebumps prickling that area.
So we listened to Aaron's assessment of Louise, and this activity asks us to determine what should we do next? What should Aaron do next? And so I'm going to select the correct answer, which is because of the assessment that's been obtained, that Aaron should remove the short peripheral catheter and perform a neurovascular assessment. So I selected the correct answer, and it validates my understanding of this activity. So we've covered specifically in this module infiltration and extravasation, as well as infection. And so we have some activities with those various complications. We learn how to intervene. And in applying how to intervene, we have 3 application questions for the learner in this activity. And then we apply what we've learned in the various modules to Theo. We learn a bit about Theo's situation with his short peripheral catheter site, which is red and painful. And then we begin the activity and learn how to intervene using the various resources of patient information, asking our patients some questions, and asking our peers. And then we document what we have done with Theo. The final module is taking the challenge. And in this module, our goal was that we were testing our learners on the most important information that they should take away from this program. So we have some knowledge recall questions, we have some application questions, and patient scenarios. In this first activity, this will be an example of what we've done, is we have covered modules 1 and 2 with 10 different questions, and so on. So each of these various activities covers the prior 7 modules. Once we complete those activities for our final challenge, we apply everything we've learned with 3 different patient scenarios. Once the learner has completed these various scenarios, I'll expand the last one. We apply what we've learned. And once we've completed all of those scenarios, we would select completion, and we would receive our certificate of completion of the FIT program. So that is a very brief summary and overview of the program, showing you some of the features and benefits of the program and some of the teaching modalities that we used in the FIT program to engage our learners. So we thank you for watching the demonstration of the FIT video, and please let us know if you'd like to continue to gain more information about how to use FIT in your organization or your program. Thank you for attending.